He's a super smart dentist who knows a lot about teeth. He's going to tell us about the newest things in dentistry, how to keep our teeth healthy, and ways to get dental care that doesn't cost too much. Whether you know a lot about teeth or just want to learn how to keep your smile bright, you'll find something interesting here. We'll cover many topics like why brushing your teeth is important and what's new in dental technology. We've already got some questions from you, our viewers, and we'll answer them. Plus, you can ask more questions during the show. Before we start, let me tell you more about Dr. V. He's not just any dentist, he's a periodontist, which means he's an expert in certain types of dental care. He works at ToothHQ Dental Specialists in the Dallas-Fort Worth area in Texas. And guess what? He's even writing a book that's coming out next year. If you want to know more about Dr. V, check our website at www.mytoothhq.com. So let's get comfortable and ready to learn lots of cool stuff about taking care of our teeth. Let's begin our dental live show. Welcome everyone, and now let's welcome Dr. V and start our show.
Thank you, ma'am. Thank you. Hi everyone. I'm Dr. Kumar Vadivel, but you can call me Dr. V. I'm very excited to be here with you all today. Let me tell you a little bit about myself. I'm a board certified periodontist, which means I'm specially trained in taking care of gums and bones that support your teeth. I'm also skilled in dental implants and oral surgery. I'm part of the American Academy of Periodontology and American Board of Periodontology. That's a fancy way of saying I work with a group of dentists who are experts in gum health. I started ToothHQ Dental Specialists, and we have, as you guys know, 4 locations in the Dallas-Fort Worth Metroplex, and we are all about making sure your teeth and gums are healthy and strong. Now I'm here for you. I would love to hear any questions you might have about your teeth and gums. You can ask questions right here, live right now, or send them in for our next show. Your questions really help us make these shows really helpful for not just for you, for everyone around the world. And one more thing, if you like what you're learning here, and please let us know. Your feedback is super important to us, and don't forget to like and subscribe to our channel, and so you won't miss out on the latest and greatest updates and helpful tips for your dental health. I'm looking forward to talking with you all, everyone, answering all the questions, and let's make our smiles as best they can be. Let's get started.
Let's go.
Awesome.
All right.
Awesome. Very
No
good.
further ado. Dr. Vadivel, can a poorly made crown cause a dental implant to fail, even if the implant itself was placed correctly?
Fantastic question. Can a poorly made crown, and hey, what is the connection between the dental implant or the device and the crown on the top of that? You know, this is something that we say all the time to our patient. Implants are great. They don't get any cavities because they are metal, and then they don't get any root canal, but they do get some gum disease around them because they are surrounded by the gum and the bone. When you have gum disease that affects the bone and the gum, and you may end up losing the implant. Guess what? One of the most common reasons to why you may get some gum disease around the dental implant is because of a poorly made crown. For example, we call it as a mushroom, right? If you have a small implant and then you have a big implant sitting on the top of that, and you are not able to floss and then go around the implant and then keep it clean, to keep it clean by flossing around it or brushing around it, and if you're not able to do that, and if it traps a lot of food, and which is nothing but bacteria, and you may end up getting gum disease around the implant, what we call it as a peri-implantitis, which is inflammation around the gum, and you may end up losing the implant. So to answer your question, absolutely, a poorly made crown or a restoration can break your implant. Talk to your dentist if you're concerned about it.
Absolutely.
Mm-hmm.
Get an implant. For implants.
Get an implant check. Don't
I'm
say,
sorry.
yeah.
I thought it was a standard crown because you started talking about cavities.
Yes,
and I'm like, yeah.
Mm-hmm.
Okay, sorry, you guys. All right, I'm a beat behind. I've been experiencing increasing pain in 2 filled teeth and recently in another upper tooth. An endodontist found cracks in the silver fillings, and I started using saltwater rinses a few months ago. Is there any connection?
So you are experiencing pain on the filled teeth and recently on the upper tooth. Then the endodontist says that you have cracks on the silver fillings that you have. Front tooth, like I'm assuming that you're kind of like saying not just in the front here, you're saying just in the front here. So that's where we do silver fillings, and very rarely we do silver fillings on the front teeth, real front teeth, or we call it as incisors on the front here and here. So if you have sensitivity on any type of silver fillings, what you're calling as a front tooth, whether here or maybe in the back, they possibly did some silver filling. So what can you do? And you saying that you start using saltwater rinses, and whether the silver filling can cause the connection? Absolutely. And anytime you have a filling, not necessarily a silver filling or any type of even a tooth colored filling, there is always going to be any type of what we call it as a micro leakage, or there is bacteria that are kind of leaking under the filling, and they are going inside the tooth, and when they reach the nerve, and that's when you started getting some sensitivity. So it is good for you now. If you're just starting to have sensitivity, go to your dentist and then have them possibly remove the filling and inspect it, and then maybe redo the filling, and you can possibly get away with that. But if you don't, then if the cavity reaches the nerve, and you may end up needing a root canal. And sounds like you probably ended with the endodontist and in an early stage, and I'm not sure what the recommendation was. And a lot of times what I've seen is, like, if you particularly have a silver filling, then they are going to recommend replace that filling, particularly the endodontist, because the metal conducts the heat or the cold like faster than some of these composites, and particularly some of these older metal fillings, they conduct the heat or the cold much faster than the newer generation of the composites. So sounds like you were possibly getting away by using the saltwater rinse, and if it is an age related problem from the silver filling, get it checked out with your dentist, and then, or it may be just a coincidence that you are getting that, but anyway, get it checked out. And if you go in an early stage, and you should be able to save the tooth and make sure that you are going to keep monitoring.
That's right. Okay, so go and see your dentist. My father has been chewing tobacco for a long time. Recently, he's developed a persistent cough. Says spicy food causes a burning sensation, and his eyes water when eating. Could these be early signs of oral cancer?
Of course, it could be. Particularly, I'm concerned about the chewing tobacco. One of the most common reasons why people get oral cancer is because of chewing tobacco. And particularly, the chewing tobacco comes in many different forms, and it could be a smokeless tobacco, or like some kind of a beaten nut associated type of tobacco that your dad may be chewing. So absolutely, it is a cause for concern. And now, on the top of this, and you are also saying that he is having persistent burning sensation on the throat, and which particularly is coming from the spicy food. So what I can assume that is, if he has any type of ulcer, which is not uncommon from having cancer, and particularly if you're using spices and that is kind of aggravating the burning sensation, you have all the red flags that I can think of, right? And let it be, like, not cancer, but you have all the reasons to go to your dentist to get that checked out. And that is what we do all day long. So make sure to come see us. And if you are in the Dallas-Fort Worth area, then we can at least check out and then see whether we are visually able to see any type of cancer-related signs, or we can send you to the right specialist and to get that checked out to make sure that there is nothing you need to be concerned of.
What if he has a low tolerance for spicy food?
Tolerance for spicy food? Mm-hmm. Well, sounds like he has.
He said it burns a little.
It burns a little, right? And so it sounds like he possibly may have some intolerance to spicy food. Yeah, it is very possible. Yeah.
Maybe he should lessen the spice level.
Lessen the spice level. Always
It
good.
all goes away.
Always good. Right.
All right. I came across a product called Cohilan Teeth Straightener, or for underbite that claims to correct underbites using moldable aligners. Can you share your professional opinion on its safety and effectiveness for adults and teens? That's a really good one. I'm quite interested to hear.
So, I'm just going to say like over-the-counter aligners, because this particular one they're mentioning here, Coheal-Un, that's what like they are referring to. This particular color is referring to, but I'm going to generalize it by saying it is an over-the-counter aligner. There are so many aligners on the over-the-counter. So the challenge is, which is a good one? Which is a good one that is going to help you keep your teeth? I'm not like overestimating here, and I'm not joking. If you do not use the aligners properly, or if you are misusing, or if the aligner is not fitting properly on your teeth, you may end up exfoliating your teeth, meaning like the teeth are just going to come out your mouth, fall out, because when you are using it improperly or the aligner is not fitting properly, then the teeth are going to move like crazy. Then you are going to end up losing those teeth. Guess what? There are so many professionally used aligners. What I'm saying is, I'm a licensed dentist, and some of the companies are selling those aligners for me to professionally use it on my patients. Even those companies have pulled some of those aligners from the market. Now the government, because of all the craziness going on and people are buying these aligners over the counter or direct to consumer, right, left and center, now the FDA is watching, and then now they have pulled out even some of those and because the FDA is watching, and some of these companies, even before they get into trouble because of the inconsistencies or the results not being consistent, and they have pulled that out of the market. And then because we are being monitored by the state regulatory authorities, several states, we got 50 states in the United States, and several of the states have mandated you cannot buy these, any company cannot sell these aligners over the counter. Particularly, they are claiming to have professional results, and they cannot sell it over the counter as mandated by the state. So if you are looking into something that is sold on Amazon or eBay or any other internet sites, be very cautious and do not end up losing the tooth. So be safe.
Be safe. Okay. Can a dentist perform laser teeth whitening on a patient who has removable dental appliances?
Absolutely, yeah. So when you have a removable appliance, and it's very easy, as you said, it is a removable appliance, right? Like take it out and then do the teeth whitening just like any other teeth whitening, whether you are doing laser whitening or any other home care type or like take home whitening. Absolutely, you can do that. It is absolutely safe.
And you just take the appliance out, right?
Take the appliance out.
Take the appliance out.
And put the appliance back on there. Yeah.
All right. Oh, what if their tooth shade doesn't match anymore?
That's a good question. So, can you expand on that a little bit so they can understand?
Or you can't whiten a prosthetic.
You are absolutely right. So what Shai is saying is, like, let's say that I have a tooth here that I'm wearing a prosthesis. Now it is matching the color of my existing teeth whenever my dentist gave it to me. But now I'm whitening all of my front teeth here. Let's say I went 2 shades or 3 shades whiter by using whatever the strongest product that I can get over the counter. Now my appliance is not going to match. So that's a good point. So make sure that whenever you're whitening, and you're not going too Hollywood white, right?
Yeah. That's right. Okay, just looking out for you guys. How does the cost of laser dental treatment in Dallas compare to other areas in Texas?
You're very comparable, and we say, hey man, we are cheaper in Texas as compared to many other states, like California or New York or like the coastal regions, and Texas, as you guys might know, it's a bigger state, and the cost of living is relatively cheaper here. The cost of labor is relatively cheaper here as compared to many other states. So we are relatively cheaper or inexpensive than any other states that you can think of, and particularly for on the lasers, on the lasers where it is mostly used states, I can tell you. But however, like the question, going back to your question, is definitely depends on the region that you live in or the city that you live in, and whether you are going to a specialty practice or a general dental practice, and whether you have any type of insurance that you carry that may be covering the laser procedure, or that specific dental office or the specialty practice that you are going to, whether they are offering any type of package services. And in our office, we do like a one flat fee for
Yes.
irrespective of the number of sites that we are using the laser. So that really matters also. And then also the value versus the cost that you're getting, right? For example, we have patients here in our practice and they got a failing implant, and they have invested a lot of money on, and they have a failing tooth, and they don't want to lose, and then they will end up spending a lot of money if the tooth needs to be replaced with a dental implant. So we say we charge these patients a decent amount and an affordable amount, and we have Shy offers a lot of affordable payment plans to our patient. Then that's what we are here for, and make sure that you're going to come see us in Texas. If you're in other parts of the region, they are charging you a lot. Just take a flight, come see us, right? Or we got two patients yesterday. They drove from Oklahoma and to see us here. So if you're in the nearby states, and come see us, and we can definitely help you.
That's right.
Yeah.
Okay, before we jump into our live questions, what is the typical cost of wisdom teeth removal in the U.S., and does dental insurance usually cover the procedure?
What is the special that we run?
Oh, yeah. As of right now, we're doing an $1,800 wisdom teeth special for all wisdom teeth, no matter how impacted.
And it includes
free IV sedation.
You got it right. Yeah. So in our office, and we have a package that we run. It's $1,800 that includes removing all four or all three, whatever, how many are wisdom teeth that you have? Just four. Like sometimes people have 13 wisdom teeth that I've seen, and we won't be able to cover that on that price. But if you have four wisdom teeth, and if you needed sedation, no matter how impacted they are, it is going to be covered under that price. But to answer your question, what is the price, right? So it could be ranging anywhere between the minimal of about $1,800, and that does not include insurance. And if you do have insurance, your cost could be going as low as maybe about $400 all the way up to like about $1,000. And does the dental insurance cover these procedures? Absolutely, yes. Most insurances, and if you got them particularly through an employer, yeah, they do definitely cover. If you got a private insurance, and we can't really say they always do. And guess what you do all day when you bring your benefits?
Yep, we verify.
You verify, and you give them an estimate before we start the procedure, so they know exactly what they're getting.
That's true.
Perfect.
Yes.
Yep.
Mm-hmm. Absolutely. Okay. Well, we can jump into the live questions now. Okay. Let's see what you guys have been sending in to us. Okay. Alrighty. Hi, doctor. I am 30 years old and have 29 teeth, 14 on the top and 15 on the bottom. I've never had any teeth extracted, and all my teeth erupted normally. There's no more space for any additional teeth. Is it normal to have only 29 teeth, or should I be concerned?
Absolutely, yeah. So people have either 32 or 29 or sometimes even less. And sounds like you probably never had any teeth extracted, and sounds like you have a complete set of teeth. And if you are functioning normally, right, whether you have 28 teeth or 29 teeth, and it is not uncommon. Speaking of the 28 teeth, right, whenever we have whenever we are restoring these teeth fully, and sometimes we give them as minimal as 12 teeth up on the top and then 12 teeth on the bottom. We call them as first molar occlusion. So we don't go beyond the 24 teeth. So it sounds like you got more than what we
Others
would normally do, right? Yeah.
Yeah.
And the full mouth rehab. If you're functioning perfectly with those 29 teeth, and as long as other teeth are not moving, and then you don't have what we call it as a full occlusion, so the top teeth are biting on the bottom teeth like that, and you have complete occlusion, you should be fine. And then make sure that you are going to check with your dentist every time you go, and all good.
All good. Perfect. Well, thank you for sending in your questions. Does that mean they probably just don't have wisdom teeth? Like they're missing?
Absolutely.
Three
Now,
wisdom
wisdom teeth for sure, and then maybe some other teeth missing on the top. Yeah, more either some premolars or maybe some additional molars, or maybe sometime you got like these lateral teeth, like we call lateral incisors, and those are one of the most common missing teeth as well.
Canines?
Canine could be impacted, so she may or may not know they are impacted all the way up, and she may be thinking, unless an x-ray was done to completely prove that like she got missing teeth.
Got it. Okay. Well, hey, maybe they just haven't erupted yet. How old are they?
29, she said that.
30.
30, yeah. 30, yeah.
Do your wisdom teeth erupt after that?
Normally, no. Normally, if you don't have any teeth come in, by then, like they're not going to come through, particularly if you are making sure that an x-ray is taken and you don't have any impacted teeth.
Okay.
But they may break through the gum sometime. If you have constant chewing and some inflammation, they may break through, but they're not going to completely fully erupt normally.
Oh, girl, we're on the same boat.
Mm-hmm.
I only have one wisdom tooth. I'm almost 30.
I had 5. I'm
You're
smarter.
special. Oh,
I'm smarter, right?
special.
You said special?
Special.
Oh my goodness. Okay.
Special. All right, Dr. V. Besides being quicker, is there any difference between traditional and laser dental fillings?
There are a lot of additional advantages that come with the laser fillings. For example, like comfort, and then the precision, and the reducing the bacteria, healing and sensitivity, and other like less tool usage. For example, some of the dentists that we normally work with, and when we do a lot of laser dentistry, they say, oh, you don't even need a shot, meaning you don't even need an injection. And because of the laser precision, and we are able to see them very clearly, the light passes through, and sometime whenever we prepare the cavity, that we are able to prepare it even better, or able to remove the cavity even better. Because of the laser, we can visibly really clearly see much better than using the regular hand pieces. And one of the greatest thing that we do is the reducing the bacteria from the gum disease, and that's exactly what happens whenever you use the laser. We are able to kill the bacteria. So that's one of the most common and the biggest advantages to clearing the bacteria. And then anytime we use some of the hand tools, then we call it because of the heat it is generating, it may cause some sensitivity. But whenever we use the laser heals that heat by heal the inflammation. What we call it as a photobiomodulation. So sometimes you don't get as much sensitivity after the laser filling. So there are many advantages, like I said, the comfort, precision, reduced bacteria, and the healing, and the quicker healing and sensitivity.
So they're not using composite?
They are using, So what the laser is being used is to prepare the cavity. So after you prepare the cavity using laser, you still have to use the composite. Yeah. So what you are asking is, traditionally, if this is a hole, we prepare. There is a hole, we prepare that with the regular traditional handpiece, and we put the composite filling. And when we are doing laser dentistry, we are using the laser to remove the cavity and prep the cavity, and then we put a composite filling.
Fair enough. Okay, so there you go. Hopefully that answered your question. Is it faster? No, it's not faster.
Oh, it is faster. Yeah, a little bit faster too as compared to, because the laser cuts really faster.
And no numbing?
No, sometimes no numbing is required.
Okay, fair enough. All right. So before we get into our game, we'll do one more question that was sent in. Hi, Dr. V. I'm Michael from New Jersey. I had a crown for 3 years now, but my gums have receded and the root part of the tooth is showing. Can laser gum treatment help with this? If so, does the crown need to be removed before the laser treatment? And if the crown is removed, will I need to replace it with a new one?
All right. So you have, bottom line is you have receding gum, Michael, right? So when you have receding gums, can the laser help with the receding gum? Without seeing you, I can obviously answer your question. But from what I'm seeing, what I'm hearing from you is you also have a crown. And if you have like a lot of gum disease going on, and if you have what we call it as a trauma from occlusion, meaning like the opposing tooth is pounding on the tooth to make the gums kind of go away. And the first and foremost thing that needs to be done is to do the laser. And to do the laser, that you can at least control the inflammation around the gum. And then we also at the same time, anytime we do laser or anytime for any type of periodontal treatment, we also check the bite forces to make sure that you're not pounding on the teeth. Sometimes the gum recession may correct itself. We call it as the bouncing. So if it does not correct, and it's very easy for you to get gum grafting after the gum inflammations kind of settles down.
All right. Very nice. Okay, so how about we get into another question and then we'll get into our game. My friend Kofi is 35, uses Nim Danton, all right, for oral hygiene, and has healthy teeth and gums. I follow standard dental care, but I am considering adding neem. What is the safest way to use it, or are there good neem-based products you recommend? Can we start with what neem is? What is neem?
Okay, so a lot of people, they don't know what neem is. So that is the reason why I wanted to actually pull this picture and show them right here. See that? The neem Dayton.
Oh, it's a stick, like a mint stick?
It's almost like a mint stick. Yeah, exactly what you said, right? Neem is a plant that looks like mint, but it has like a stick that is like where the leaves are coming from. And it's not uncommon for people who are believing in natural medicine. People are looking for, particularly in the society we live in, nobody wants to use fluoride, and a lot of patients are asking if you guys are particularly whichever part of the US that you guys are living in, you guys are hearing a lot of controversy about the state is announcing no more water fluoridation. So now my patients are asking, the state is pulling the fluoride out of the city water, and now what about the fluoride on the toothpaste? And what the FDA is going to do, like, we don't know. So anyway, speaking of that fluoride controversy and keeping that aside, coming to our neem Dayton, so it is like a natural stick. So the neem has a lot of anti-inflammatory properties and a lot of healing properties, and people add this neem in the olden age. Like, you can go to Amazon or eBay now, you can actually buy those sticks. And what people do is we actually had a patient 2 weeks ago, if you remember, like, he was saying
yes,
that he used to pull the stick out from the backyard and the trees, and then you used to crush them and then you used to brush. Exactly. Remember
I
that?
think you just know how it goes. I don't think he said all.
Yeah.
Okay.
But do you remember that patient
do.
saying that,
He
right?
did
Yeah.
say it.
So that's what so you get the stick and then you crush it with the stone and then you use it like a toothbrush, right? That's what you do. So because of the anti-inflammatory properties and the healing properties and the antimicrobial properties, that's how the stick works. And because of the healing properties, and there is a lot of companies now, they are adding neem to the toothpaste and they are making neem toothpaste, and then there's a lot of neem mouthwashes available and a lot of other cool neem products available too. So to answer your question, can you use it? Absolutely yes. And do I exclusively recommend neem product? My recommendation would be to use some kind of a fluoride toothpaste and then add neem on the top of that to get the fullest benefit of to preventing the cavity from fluoride, plus whatever the benefits that you feel like you are getting emotionally, just get that as well from neem.
Very cool. I envisioned like a tree branch with leaves. I didn't know what he meant.
Well, that's what it is. Yeah,
Well,
that's exactly what it is. Yeah, right here. Yeah, look at that.
Looks like a prettier version of what
Pretty tree, right? Yeah.
Yeah, imagine. Yeah. Interesting. Okay.
Very natural, though.
Yeah, apparently it works.
Very natural. It does work.
Okay.
Yeah.
So is it a substitute to traditional brushing?
Well, it's not a substitute to traditional brushing. People don't do the stick anymore. So I'm assuming that the person is referring to adding some type of neem, and so in the modern society we don't go brush with the stick, but instead you will be adding some type of neem toothpaste or some type of neem mouthwashes. Yeah.
Very cool. Okay, well, I'll look into that. All right, so we are going to give Dr. Vadivel a break, and we're going to play rapid fire.
So you're gonna take that? If you're gonna give me a break?
No, you just don't have to like give a long-winded
Oh,
response.
okay,
Yeah,
got
I'm
it.
just gonna cut that down for you. Yeah, just a
okay.
brief moment.
Mm-hmm.
Absolutely. So, we'll have you answer the question within 1 to 2 sentences in less than 30 seconds.
Okay.
Yeah.
Okay.
All right. First question: is dental CT scan safe during the 5th month of pregnancy?
Absolutely, it is safe during the 5th month of pregnancy, and your OB or the gynecologist OBGYN is going to release you. But do we normally do it unless it is not required? Like, we won't do it, and we'll take a smaller X-ray.
Okay, very nice. I feel like that was more than 2 sentences, but we'll let it go.
You'll forgive me.
Yes, for this one, you're pardoned.
Okay.
All right, number 2. Can a dental hygienist use a laser?
Absolutely. In many states, including Texas, the dental hygienist can use laser. Absolutely.
That is right. The LBR specifically.
Mm-hmm.
Right?
And the LD, laser decontamination, LBR, which is laser bacterial reduction.
Mm-hmm.
You made me speak more than 2 sentences.
Darn it. Oh, no, I didn't actually. I was giving you a break.
Okay.
Yeah, you just took it and ran with it. All right, last one. So the game is over. Can laser hair removal for hirsutism?
Hirsutism, yeah.
All right, affect the gum line or dental roots? They heard you.
All right. So the laser treatment in any other part of the body, it's not going to affect your teeth or the gums. So you can do as much laser you want in any parts of the body, and it won't affect your teeth.
Awesome.
Or the gums.
Perfect. All right. So we'll jump back into our viewer questions, but definitely continue to send us comments and ask your questions, and we will present them in the live show. You might be next. I had a front tooth root canal 6 months ago without a crown. Now there's a slight sensation, and my dentist says gum infection from poor filling care may require a crown. Can laser treatment help instead, and is a crown truly needed long term?
So if the sensation is coming from the gum infection that the dentist is saying, absolutely, the laser can help. And if the gum infection, if the sensation is coming from a poor filling, then you may need a replacement, or if the filling is to the degree that it is the gum infection or the gum irritation is coming from the filling, can that be a crown situation? Absolutely yes. Without going too much into the detail, without seeing you, of course, right? So the laser is absolutely going to help with the gum infection, and whether to prevent the infection from coming back, whether a filling is required or a crown will be a better option. That's something that my recommendation is to talk to your dentist. Yeah.
There we go.
You got it.
All right. What's the biggest mistake people make when trying to whiten their teeth? I'm scheduled for a whitening treatment next week, so I'd really appreciate knowing the key do's and don'ts before and after the procedure to get the best results and avoid any issues.
All right. So you can definitely carry on with your routine life before you do the whitening. But some of the biggest mistakes people make are to do the at-home whitening right before they go into the professional whitening treatment, because your dentist has some certain expectations to what materials they are going to use based on what they are going to see on their teeth, and depending on your expectation of how many shades that you want to whiten. But if you are going to overuse the chemicals, because your dentist may not know what chemicals that you are using at home, and if you end up using the chemicals over, and particularly if you are not disclosing to the dentist what are you using at home, then it can definitely increase the sensitivity. So what else can you do? What else you can do? You can use some regular brushing, and you can remove some of the stains from some of the regular toothpaste that you use, but don't use like real too much whitening toothpaste or a charcoal or too much hydrogen peroxide. That will increase the sensitivity. But what can you do to decrease the sensitivity issues, or to prevent any problems? Like, don't do too much whitening because it might increase the sensitivity, or don't do at-home whitening or continue without the recommendation of the dentist. And then the whitening is going to disappear if you do not follow the instructions, using the proper mouthwash, not eating a lot of colored food or spicy food, or not using not smoking or using any type of tobacco products, or particularly chewing tobacco products. And these are the absolute must. And even coffee might stain your teeth. These are the absolute must. Either you should totally avoid, or if you're drinking coffee and such, maybe cut down on that, particularly if you want to keep your Hollywood teeth.
That's right. What if you use a straw?
That's a great question. If you use a straw, and if you are going to suck it in like really okay, then it's okay. But if you sip it after you suck it through the straw, then that's not good.
Right. Okay.
Or keep it in the mouth, I mean.
Yeah. When they like switch it around. Yeah. Absolutely. That's a weird habit anyways. You guys don't do that. All right. Before we jump back into the live questions, so definitely keep sending them in. I had a root canal 10 years ago, followed by a post in crown after the tooth broke. 2 weeks later, I had pain and swelling. Turns out the tooth was cracked and had to be removed. Even after extraction, I'm in constant pain that's now radiating to my eye and head. Painkillers aren't helping, and I'm feeling helpless. Where's the question?
Well, that's what we do, like ongoing pain after tooth extractions, right? So ongoing pain from after tooth extraction, it could be due to multiple things. It could be due to a residual infection, meaning that the infection is coming back, or the infection is not going away, or it could be from what we call it as a dry socket, because the blood clot got dislodged, and it could be due to some kind of an inflammation, what we call it as osteitis, or if it is due to infection, like it could be what we call it as an osteomyelitis, and or it could be some kind of a weird nerve pain, like we call it as a neuralgic type pain, and it may be from even just from grinding your teeth. And although it may not be coming from the tooth that you got extracted, but it could be because you grind your teeth, it could be a radiating pain from the other teeth that is kind of going through. what should you do? Just don't ignore. You don't definitely want to be in pain. So whenever you go back to a dentist, and they may be able to take some X-rays or another CT scan to find out what is going on, and they may give you some antibiotic, and if it is infection, or they may give you some steroids, like if you are muscle relaxants, and you may be grinding your teeth, and they may ask you to use some hot pack or warm pack or cold pack. Particularly if it is few days after, we are normally going to recommend some warm pack and put you on some stronger pain medication, or use a combination of ibuprofen, prescription strength ibuprofen or Advil, along with the regular pain medication. So there are multiple things, and one of the things that we do in our office is, what we call it as a socket gel or a healing gel. Patients just love it. And if you happen to be in the Dallas-Fort Worth area, definitely come see us. And not many offices these type of using or dispensing these healing gels. And I got patients, particularly when they come after the extraction, like after 2 weeks. Hey, doc, one thing that I want to let you know that help is the gel. Can I get one more of that refill, right? So that's what, and particularly when they're hurting, sometimes patients don't want to take pain medication. They're asking, hey, can I get the healing gel? So that's something really helpful.
Absolutely. Okay, so we're going to go ahead and jump into our live questions. I have a NT eye bite guard I wear at night from 2007. I now have lower recession on my lower teeth. Could that be from the bite guard?
Absolutely, yes. The NTI bite guard meanings, like for example, that sometimes fits the lower front teeth. So meaning, if you are using the night guard, let me make sure that it is like the one that I'm referring to. Sometimes these guys change the trade name. I just want to make sure that I'm referring. Yeah, that is exactly what that is. Yeah. So if you're seeing right here, see that? It is right in the front teeth. So it's almost like, it's like a Mickey teeth, right? You can see that. So what happens is, like whenever you have this NTI night guard, you're pounding on just the front teeth. One of the most common reasons why the receding happens is because you keep pounding on the teeth. So if you do, then no matter what, even if you go back to regular night guard, it is not going to fix the problem, and it'll only prevent the ongoing issue, the existing receding that you have. You can't fix it. So my recommendation would be that you go back to your dentist and check with them and see whether you have any type of damage that happened, and definitely stop using it before you go see the dentist. But don't prolong it. Don't stop using it today and then wait for another 3 more months, and then you may end up losing your teeth if you already have what we call it as a lot of trauma from the occlusion, trauma or damage from the biting. So go back and see the dentist. So one thing that I did not say is, one thing I want to cover, I should say, I did mention it, but I did not say cover it. So after you get the right night guard, then or before you get the night guard, my recommendation would be come see a periodontist, or go see a periodontist like me, and we can fix the gums, and then we can fix the bite issue if you had any. After you fix the bite issue, now you wait for about 3 to 4 months, and then you get the night guard because the teeth have adjusted themselves. Now you do the night guard, then that is going to be the best investment that you're going to make, and it is going to be worth your money. Because if you do get the night guard, come to see me to fix the gum. Then if I end up doing the bite adjustment, then you will have to go back to a dentist, or you may have to pay us again to make a night guard.
That's right.
Okay.
All right, you guys. So we'll definitely jump back into the comments. So keep sending your questions in. Hi, Dr. V. My mother is 70 years old and has medical conditions like high blood pressure, diabetes, and thyroid issues. Her dentist is recommending several root canal treatments and a few implants. Why do dentists usually suggest these more complex treatments instead of a simpler option like tooth removal and dentures. Are there real advantages of implants and root canals over dentures at her age and with her health conditions?
Great question. Yesterday, like if you recall, like when we were teaching the implant class to the dentist, like yesterday, we said age no bar.
That's right.
Absolutely, age no bar. Do you remember the patient that we saw in Grapevine a couple of days ago, the 92-year-old, right?
Yes.
You are talking to the niece and his wife, right? And so 92 years old, patient is getting an implant. And my oldest implant patient, by the way, is 106. And the 92-year-old that I saw like last week, and I was just telling her, hey, whenever I'm going to do an implant, I'm going to take a selfie with you and I'm going to put it on your wall of fame, put it on my wall of fame that I did an implant on a 92-year-old. But to answer your question on when you have diabetes and high blood pressure, and you didn't mention cholesterol, you only mentioned thyroid. More than likely, if you have high blood pressure and diabetes, and you are more than likely you may be getting some cholesterol medication too, because this is a classic triad that we normally see. Just because you have high blood pressure or diabetes or high cholesterol or even thyroid, you are not, I wouldn't say that you are not a good candidate. Anybody is a good candidate as long as you have things under control. When you have things under control, you are as good as anybody else and any other patient that we treat in our patient, any other healthy patient that we see. And you mentioned about age, and age is no bar for implants at all. I already mentioned that my oldest patient is 106. And why are the dentists recommending implants and root canal treatment? Hey, now it's all about quality of life. Patients our people are starting to live longer, and don't you need teeth at 80 years old or 90 years old or even 100 years old? You need teeth to be able to chew. And having natural teeth or having implant teeth which are as close to the natural teeth as possible are the best one to lead a healthy life. So we always recommend you get replacement teeth, and my recommendation would be to get implant to replacement teeth, and before you remove teeth to get replacement teeth, if you're able to save them with root canals or gum disease treatment, absolutely go for it. Age no bar, medical conditions no bar.
That's right. Don't let it hold you back. All right, so we'll jump back into the last live question of the night. But don't hesitate to send your questions in, and we may answer it on the next show. While sleeping, I will take out my retainer and wake up chewing on my cheek, and my mouth is very dry. I have noticed my teeth have been shrinking. Could that be from dry mouth?
So the teeth have been shrinking? Notice my teeth have been shrinking. Okay. Man, teeth have been shrinking. Unless you think that like you are referring to the teeth have been moving, which feels like, if they're hiding behind one another.
Oh, shifting?
Yeah,
shifting.
Oh, maybe
Yes.
It is a typo.
Yeah.
You're
Hey.
right. Thank you. I didn't think about that. Yeah, shifting. If
All
your
right.
teeth are shifting, could that be due to dry mouth? No. The teeth do not shift because of dry mouth. Could that be a rare occasion they may shift because of dry mouth? Possible. However, when you're taking the night guard out, and if you are not going to use it, and I don't know what the recommendation is from your dentist or the orthodontist post the braces treatment. If you were a classic, a lot of crowding, if your dentist or the orthodontist recommended you wear your retainers 24 hours and you're not supposed to take it out, and if you take them out like even 1 or 2 hours, sometime I've seen like teeth kind of shift back, particularly if you're taking it out overnight or leaving it overnight, or you're leaving it out like during the day, there is a very good possibility they may be shifting. My recommendation is go back and talk to the dentist or the orthodontist and see whether there is a cause for concern. But just completely relating to the dry mouth, I don't think so. But again, check with your dentist.
Absolutely.
Or the orthodontist. Yeah.
That's right. We gotcha. Okay. I've been experiencing constant TMJ pain for the past week, likely due to my working posture with a laptop. The pain radiates to my ear, neck, and even down my hand. My doctor has recommended physiotherapy. I also have a dental implant in the first molar area. Will that interfere with the physiotherapy in any way? Are there any precautions I should take?
Absolutely not. One of the most common questions that people ask, questions, and they always say, "Oh, I'm going to ask you a weird question, and will my dental implant, start the alarm when I'm going through the checkout, through the store checkout."
Oh, the beep beep.
Yeah, the store checkout and through the
airport thing. Yeah.
The airport security. So those are the two common questions, and then also like people are concerned about the MRI. So that's another thing. So it does not affect. Does not set your store alarm. It does not support your security line alarm at the airport, or it does not interfere with the with your with your MRI, and it does not absolutely interfere with your physiotherapy at all. But what about the pain you could be where you're feeling beyond the jaw? Could that be related to? Yeah, absolutely. It is going to be related to your TMJ. Whether if you or dentist feels that you could benefit from getting the TMJ therapy done, my recommendation is definitely to consider that. A lot of times, whenever people have TMJ issues, they are going to look for like a miracle cure. Oh, I'm going to go for physiotherapy, then that's going to be the miracle cure. No, you should really be doing like a lot of home care, and you should be watching for yourself in addition to getting these type of therapy. For example, using some kind of a moist pack, or watching for like a really like chewy food, not opening your mouth wide. For example, I always tell my patients, if you are eating a sandwich, don't open your mouth. Just chop them on, then put them on the back teeth. Don't try to eat like an apple with your front teeth. And when you're opening your mouth wide, then that's when the jaw pops. And then even like a sandwich, don't like a Subway sandwich, don't open your mouth wide. Just chop them off and then put them on the back teeth. Then no chewing gums, and that is one of the most common mistakes people make.
Peace every once in a while.
You do.
I chew gum sometimes.
Yeah. Okay. Yeah.
Oh goodness.
Yeah. Okay.
Sometimes.
Oh, and then one other thing that she said. What about like my laptop, right? And I don't know whether when you're working on a laptop and you put your hand like this and then you look at it, when you put a lot of pressure in the joint, that might do. And then one of the common thing that I hear is like people sleep on one side when you put a lot of pressure on one side, and that can happen too. Yeah. And then if I punch your face,
wow.
Yeah, that can happen too.
Does it? No.
Or somebody punches your face.
Great.
So don't get into a fight, okay?
Oh, yeah, don't fight, you guys. Yeah. Right. That was one of those. What is it called?
Particularly Friday is coming, and I need to make sure. I got to watch your back, right?
What's Friday?
Friday. Don't you party on Friday?
No.
No?
I don't.
Okay, all right.
I don't. What is it when you let the thoughts slip out? You know what I'm talking about? They're like...
Lose your train of thoughts?
No, what's that one saying? They're like... It's like a subconscious thought and you say it out loud.
Oh, you are thinking that you are going to get punched.
No! The fact that you said it, Dr. Vadivel. Oh, okay. He just wanted the world to know that.
All right.
All right.
Oh, I want the world to know that you are partying, right?
I don't party.
You don't?
I go home.
Oh, maybe you don't get punched, you say.
I neither.
No, okay, got it.
Neither.
All right.
Okay, I don't party or punch. Buddy.
Okay, all right.
Okay.
All right, if you come to work on Monday then.
No.
Oh, Friday is coming tomorrow.
Yeah, but no, today's Wednesday.
Oh, today is Wednesday, sorry.
Yes.
Yeah, okay.
And Monday we're closed.
Okay, oh yeah, so then it is definitely a good time for you to party then.
I'm going to be asleep.
All right.
All right. Okay, is there any specific quality or feature we should look for when buying a water flosser, or do most of them perform the same? Can my wife and I share one water flosser? If we use different tips, how often should we use it? And do you have a recommended brand and model?
So, man, there are so many brands. Like, I get lost, right? There are so many brands available. I get emails from, when I go for shopping at Amazon, and when I go for shopping at Walmart, they already know my entire history. They know that because I'm a dentist, particularly, they think that I'm looking for some kind of a dental products, and I get 10 product recommendations to my email, and I get so many brands that are being recommended. But anyway, so which brand is good? Like, my recommendation is look for the top brands, like Philips Sonicare or Oral-B, or like a water flosser or a water picker. Those are the top brands, like my recommendation, because these have been proven. Anytime we do like any type of research and we are testing the top brands, and no, because any brand is coming in, we are not going to test every single brand, and we are going to use that. So my recommendation would be to stick with the popular brand, because you can nowadays you can either chat GPT it or ask for Google what are the top brands, right, of the water flosses, and you can buy one. And I don't think you're going to go wrong with any type of these top 5 flosses. But going back to your question on whether your wife and you can share the flosser, depending on the type of flosser, and if you are able to use the tip, I'm sure most of them come up with interchangeable tips, and if you are able to use that, then of course you can remove that and then wipe off the unit with the with some kind of wipe or disinfectant, Clorox or some type of disinfectant. Then you can use it. That way you are not transferring the bacteria, because we call the periodontal disease as the kissing disease, because even when you kiss your spouse, or even when you share utensils or share food like through a spoon, or even when you wipe the soother with your tongue and give it to your baby, and it can pass the gum disease to your family.
What did you call it?
What do you call it? The soother, right? Like the sucker.
Pacifier.
Pacifier, yeah.
Oh my gosh.
Yeah.
Such a dad. He has 2 children.
Thank you.
Come on now.
I gotta ask my wife.
Yeah.
Or maybe I forgot with my grade.
Oh gosh.
The pacifier. Don't they call it the soother from the other parts of the country? I need to check it out. All right, pacifier. All right, thanks for correcting.
Or a binky.
All right, let's start over.
Okay.
Pacifier, or sharing utensils or sharing food. You can cause it to you can give it to your spouses or your family members. So be careful of that, and make sure that you are going to use use some type of a disinfectant. And then we already answered about the brand, and then that's pretty much it. Yeah. So, but the flossers, do they work? Yeah, absolutely. This is what I say. I'm not going to, I don't want to disprove your thought of like whether the flossers are going to work or not. My recommendation is you do the basic care with the brushing and the flossing, and then go for the water flosser on the top of that. That's just going to really work.
That's right. Mm-hmm. And what if you have the water flosser that it like has like water in the thing? Do you need to switch that out?
Well, that's a great question, right? So you have some of those like big water flossers, they come with a big tank. So don't leave the water for months and keep using it, right? And so my recommendation is like not even more than, if you're able to do it like once a day. Nowadays, like these models have become like really cheap. It used to be like $100 or like a $70 or $80. Now you can buy some of these flosses as low as like maybe about at $15, $20 or $30. And if you're really looking for like a less expensive brand, like just buy like $10-15. You got nothing to lose. And if you feel like you are getting some good benefits, and go for it. And then you can once you get to the habit of using them on a regular basis, then you can buy like a better and a bigger model, and you can spend more money now that you are using it consistently. So any brand or any bottle to strive with, and then top 5 or 6 brands, and you can buy after you are going to consistently use it. Do not share. do not with your spouse, or do not share it with your family. And if you're sharing it, make sure that you are going to change the proper tips and then wipe them with the disinfectant.
And switch the water?
And use change the water.
They can use the same
No,
water?
they can use the same water because it's
okay.
just now. I'm hoping that it does not backflow
Cycle.
into the unit.
All right. Okay. All right. There we go.
Well, thank you guys for joining, and you guys being a great audience, and we look forward to connecting with you again next month.
That's right.
Bye, y'all.
Bye.